Research shows that healthcare utilization drops during adolescence, and few young men seek out the sexual reproductive care that they need. Why is this concerning? In 2016, the Centers for Disease Control reported that youths between the age of 15 to 24 made up about half of the 20 million new cases of sexually transmitted infections in the United States.
Compared to other ethnicities, African Americans had the highest rates of reported cases for most STIs, such as gonorrhea and chlamydia, and across age groups.
In the past, sexual health policies, research, and clinical care have typically focused on girls and young women. Historically, concerns of stigma, cost, insurance, confidentiality, rapport with healthcare providers, long wait times, and fears about HIV/STI screening have impacted the decision to seek care for young African American youth.
Providing the right tools to take care of our sexual and reproductive health will open up avenues for us to continually engage in healthy lifestyle behaviors now and throughout the rest of our adulthood.
By bringing this discussion to the spotlight, we can work together to make an impact and change the current healthcare landscape for not only us, but also for all future generations. So yes, I have visited a clinic before. I visit the on-campus clinic. My experience with the clinic has been kind of bittersweet. I feel like for it to be included in our tuition is okay to use, although I do feel like the help that I received wasn't extensive, and oftentimes I've had to go right back for the same medical condition.
While I don't really have any obstacles as it pertains to going to see a clinician or going to a clinic and getting medical help, I would foresee folks not having resources such as transportation, not being able to get somewhere, not having money to pay for a copay, being uninformed as far as what you would need going to the doctor, information. I feel like there would be a lot of anxiety for a lot of people because I do know that it is very common for folks to go a long time without going to the doctor.
Things that would stop me from going to a clinic regularly is that it's kind of a negative connotation around clinics that if you go there something's wrong with you and you're not being proactive. And I think of it as being a proactive way because you go you're trying to see if something is wrong with you and catch it before it's too late. But most people see it as he has something, that's why he's going to a clinic, whatever.
I know one thing that stops me from going to the clinic regularly is convenience. Not necessarily that the clinic itself is inconvenient to get to. It's I gotta work Monday through Friday, and then Saturday I have to go this place, Sunday I gotta go somewhere else, so it's I never really have time to go.
Yeah, I've never taken a sexual education course, never was taught in anything. I had one conversation with my father when I was 13, and so that was my sexual education experience.
In high school, a lot of my community members, they were talking about how having more sexual partners was better, and how you quantify being a real guy or something. The more sexual partners you had, the more of a real guy you were. And over time I started to see that's just something somebody made up.
Honestly, the only thing I can really remember from high school is doing the whole putting a condom on a banana situation. So I will say that I feel that it should definitely be pushed out more within high schools, because I feel like I was kind of left out during that time. Or at least me personally, I feel like I was kind of left out in that time as far as being educated on sexual health.
Especially with high schoolers, just some adult telling you to use condoms and showing you the birth of a child, okay, and that doesn't really stop anybody.
there's this false stigma when you're young that like you're invincible, that nothing's gonna go wrong.
So a lot of the segments that I can think of right now around STI and like, you know, contracting STIs and things like that, it means you're promiscuous, like you are, you know, you have tons of sex partners, you don't really care about your health or other folks' health.
So somebody might feel that if you have more than one sexual partner, then that could lead to STIs or STDs, when in reality, it could only be one partner or one person.
I do know that when it comes to people getting STDs, there are some people who will automatically assume that, oh, you were in like, you were doing foolish sex, or like sex that you shouldn't have been doing at the right time, which is wrong for the most part, because it's not always a person's fault when they're in that kind of situation, especially if it comes from like rape or assault and stuff like that.
Sexually transmitted diseases are always given through intercourse. Now, they can be given from, if you're in an intimate relationship with somebody, and it may be something new, but you guys haven't gotten tested, and say you guys just share like a kiss or something like that. That's not necessarily unsanitary.
I do not feel comfortable getting help from a clinic when there are these negative associations, because like when I don't want to go into a clinic and they just like think that like you just automatically have something. It just feels like you're just in a place where you really don't want to be at.
My particular neighborhood and where I grew up, they never really talked too much about STIs or STDs or anything sexually, kind of like promoting anything or offering free contraceptives or safe sex items and things like that. So I feel that it would be beneficial to kind of like have people to go back into my community and make these things more of an issue.
Like coming from South Florida, I remember looking at like a graph in like my freshman year during the Black Student Union meeting, and it was like there was like a very high concentration of AIDS and HIV cases in South Florida, and that's something I never really realized. Not until I got to college.
I encourage folks to like go to doctors, go to community healthcare workers, folks that are like trained to facilitate, you know, and provide this information. Like go to these people, like actively seek out that information, and like also turn around and maybe be a resource for other folks if you know that there are spaces in your community that would benefit from this information. If there are things that you could do, like that you know you have the knowledge, you know you have the resources, you know, leverage those and do something with them.